Aerobic exercises. It is a type of physical activity that uses large muscle or group, is a rhythmic and continuous, and depends primarily on oxygen-based energy production to meet the increased metabolic demand of the working muscle. It improves cardiorespiratory endurance by enhancing the efficiency of heart, lungs, and circulatory system. Example: walking, jogging, cycling, swimming, treadmill exercise. Physiological basis. Energy is produced mainly through oxidative metabolism, requires adequate oxygen supply, use carbohydrate and fat as a fuel, perform low to moderate intensity of long duration. Principle of aerobic exercise: frequency 3 to 5 per day per week, beginners 3 days per week, trained individual up to 5 to 6 days per week. Intensity measured by heart rate VA2 maximum. Rating is perceived acceleration. Target heart rate 60 to 80% of maximum heart rate. Maximum heart rate is 20 to 20 per age. Minus time duration 20 to 60 minutes per session. Beginners start with 10 to 15 per minute, gradually increase. Type: activities involving large muscle group, continuous and rhythmic in nature. Type of aerobic exercise: low impact of aerobic exercise, minimal stress on joint, suitable for elderly, obese patients, joint disorder. Example: walking and swimming. High impact of aerobic exercise, greater joint loading, suitable for young healthy individuals, running, jogging, aerobic, balance, dance. Continuous aerobic training, steady intensity maintained throughout the aerobic exercise, 30-minute brisk walking. Interval aerobic training, alternating periods of activity in rest, 3-minute fast walking plus 2 minutes slow walking. Recreational aerobic training, enjoyable activity with aerobic benefits, dance and cricket. Technique of aerobic exercise: warm up 5 to 10 minutes, low intensity movement, gradual increase in heart rate, reorient muscle injury, slow walking, dynamic stretching. Coordinating phase 20 to 40 minutes. Main aerobic activity, heart rate maintained within a target zone, continuous about internal training. Cool down 5 to 10 minutes, gradual reduction of intensity, prevent venous pooling, promotes recovery, slow walking, gentle stretching. Physiological effects: benefits: cardiovascular system, increase stroke volume, decrease resting heart rate to improve cardiac output, reduce blood pressure. Respiratory system, increase lung capacity, improve oxygen diffusion, enhance respiratory muscle endurance. Musculoskeletal system, increase muscle endurance, improve joint mobility, increase capillary density. Metabolic effect: increase fat oxidative, decrease LDL, increase HDL, glucose tolerance. Psychological effect: reduce anxiety and depression, improve sleep, enhance quality of life. Indication: cardiovascular disease, post MI supervised, hypertension, type 2 diabetes mellitus, obesity, chronic obstructive pulmonary disease, stroke, rehabilitation, osteoarthritis, low physiological fitness, stress and anxiety disorder. Contraindication: absolute contraindication, acute myocardial infarction, insutable angina, uncontrolled arrhythmias, severe aortic stenosis, acute pulmonary embolism, uncontrolled heart failure, severe respiratory distress. Relative contraindication: uncontrolled hypertension, severe anemia, fever or acute infection, severe musculoskeletal, poor controlled diabetes, pregnancy high risk. Precaution: monitor heart rate and blood pressure, avoid exercise immediately after meals, maintain proper hydration, use proper footwear, stop exercise if symptoms occur, chest pain, palpitation, dizziness. Role of aerobic exercise in rehabilitation: improve functional capacity, enhance endurance, independence, and daily activities, reduce risk of secondary complication, promotes long-term healthy maintenance.